Thank you. Our next question is for Dr. Cox. The question is, where is the first point of call for a patient that seeks mental health? So where can they go at very first time when they're seeking mental health?
Yeah. And like I said, I believe in the prevention. So in my opinion, just any time that you feel like you need help, but if it's not realistic, all this wonderful list that, Victor has put out, when you know that you're not able to any of those things, then that's a time when you're saying like, I know that they're a good thing for me to do, but I can't just doing this breathing exercise anymore. I don't care, so there's a point where, what makes sense to you in terms of your stress management. But if you can't or you don't want to, and that's a really good sign. So what I suggest is whether it's you or your family members, just look at your self-awareness of how you deal with stress, and when is a point where you just think that you can't do it anymore, or just a glass of wine might be really helping you to relax. But if it goes beyond, one glass of wine, and getting into this addictive cycle, and that's where you need to be aware of, hey, what's my typical symptom, the stress. And with this population, and I talk to Asian population too, I cannot underestimate the effect of both health and mental health of microaggression that we go through every day. We don't know that we are succumb to is very obvious, and sometimes a lot of times it's not. And that's how just like Victor's saying about flight and fight, that's clogging up our blood clots and heart attack and aneurysm, and it's being proven again and again how that's impacting on a cell level, for us to continue to have a lower immune system than other people. I mean, why do you think it's COVID-19 is hitting us, people of color? It's not just a poverty, it's not about frontline and all that kind of stuff. For instance, my son is a frontline worker, and he's I'm one of those worried mom. He's out there every day, and guess what? He got the raise working on the Memorial Weekend for $20 an hour for 48-hour shift. I mean, come on. I mean, of course, I'm also grateful for doctors and nurses, but we're talking about those young men and women who's a front line, working their butt off, So, I mean, talking about, I know he's willing to, he loves what he's doing as an EMT and paramedics, and, he's just out there. But the point here is we need to really look at this whole microaggression, how that's impacting on our immune system. So all the good things that about breathing exercise and all that kind of stuff. I teach, mindfulness, and some of my patients said, I can't do this breathing exercise anymore. I'm too anxious. I'm just, I can't go to sleep. I can't, I know it's good for, for me. I know I used to be able to do it, And also another thing too, CBT is really great too, but in my opinion, it's a very much of a cognitive behavioral therapy that's based on white man's cognitive process. It doesn't really, for many of my population anyways, it's all like an English language, dominated worldview. I mean, you remember Dr. Kelsey, Mariva Kelsey's, legacy is Afrocentric psychology. So we need to really look at, again, holistic way of not just a cognitive CBT that, talking about the empirical data, whatever, but we have our own ancient Afrocentric psychology, Asians, meditation. So we need to really look at not just the cognitive process, but the overall, how that impact on our immune system.
Awesome.
So, okay.
Thank you so much. All right.